Hey there, and welcome to the Low Country Spotlight. I'm your host, Margie Pizarro. Thank you so very much for joining us again today. Today we have a special treat because, you know, Low Country Spotlight is the show we've got your back, and we're always looking for ways to help you to enhance our community. And today's guest is none other than Dr. Paula Orr, and she is the physician owner of Charleston Women's Wellness Center. Now, one of the things that's near and dear to my heart is issues dealing with wellness and staying healthy and getting that way, and that's what today's show is designed to do. So I want to start by welcoming Dr. Orr to Low Country Spotlight. Dr. Orr, thank you so very much for joining us today. We're so happy you could take time out of your busy schedule to come and sit with us.
Anytime.
And one of the things I'm so happy to announce is that you have actually agreed to be our wellness expert for issues that arise in the community. So tell us a little bit about what we can expect to hear from you throughout this journey.
Well, it's no secret that I practice women's health, and so that is my specialty. That's where I find myself as an expert, and so you can expect that I'll be able to bring you topics of interest with regards to anything that has to do with women's health. Mm-hmm. If it relates to men, mm-hmm. that's not really what I do.
Yeah. We're going to get a men's health expert too. Exactly. But we're so happy that you're going to talk with us about issues dealing with women's health. And you know, some people may think, well, why would I even need to have a doctor? I mean, if you're a doctor and you go to medical school, I mean, you know everything about the human body and human anatomy. What's the importance of having a women's physician, if being a woman?
Well, you'll get varying responses to that question. I think a lot of women actually prefer to have a female physician because they feel like not only can she relate to issues of being a woman, right, because I am a woman, mm-hmm. but they just feel like there's a different touch. Now, there once was a time where you couldn't find a female physician, mm-hmm. And women were forced to see a male physician, but mm-hmm. now that's different. There are some women who prefer male physicians, right, and I respect that. Mm-hmm. That's their choice. But at my practice, what we do is we try to focus on not just on doing the pap smears and the breast examinations, which is what people think about when they think about women's health. Right. But we also have Medi-Spa services, we do bioidentical hormone replacement therapy, we have an ultrasound technician, we do labs, we have a nutritionist on staff. So our goal is really to focus on the whole woman, not just on her reproductive organs.
Now let's talk a little bit about that, because is your specialty in gynecology and obstetrics? Even though I said that, I murdered that word.
I know what you mean. I am a board certified obstetrician, gynecologist. Mm-hmm. I stopped doing the obstetrical side of that in January. Okay. So for the last 9 months, I've just been practicing gynecology and women's health. I have a full-time a physician's assistant who is a family practice physician's assistant. So her role is to jump in the areas where I'm not quite so sure about. So managing diabetes and hypertension and sinus infections and colds and flus, all the things that you'd go to your general practitioner for. Right. I also have a provider who can handle that on site.
So it sounds like Charleston Women's Wellness Center is full service for, you know, gynecological issues and women's issues that women specifically face, but also family practice issues as well.
Correct. As long as you're not having a baby, we are referring those patients out, and then they can come back to us after they've had their babies.
Now, you mentioned Medi-Spa. Tell us a little bit about that, because one of the things that I always think, I have to have good emotional health. Mm-hmm. You know, I really think it's important to feel good, you know, about yourself, about your environment, about what you're doing. And I am assuming that also part of your services, the spa treatment services, will allow women to feel good on the outside and on the inside.
Absolutely. And that was kind of the focus, is that there's so much more to wellness than your physical body. Mm-hmm. Your emotional health, mental health is a huge issue, not just in the Low Country, but across this nation. And your spiritual health as well. But we also know that, you know, stress is a silent killer of many women. Mm-hmm. And so by taking a moment and having your eyebrows waxed, or having a facial, or getting Botox or some of the things that make you feel better about yourself when you look in the mirror, also adds to what you feel on the inside about yourself as well too. So we wanted it to be full service.
And you know, I've heard the saying, you know, you're only as young as you feel, you know, or you're only as old as you feel.
Well, I don't know. I don't know.
I don't know if that's true or not, but just in terms of an overall good health regimen, what do you recommend that people do to, again, begin the process of feeling good about themselves on the outside and on the inside? How do we get to that place?
Well, I think we would all agree that it's not rocket science.
Yeah.
I think most of us know what we're supposed to do. It's just making the time to do it. As women, our primary focus is to be nurturers and to take care of other people. And so what we've got to do is to find the time to infuse in some of those moments where we're taking care of ourselves as well. So, you know, finding the time to have a facial or, you know, to get your nails done is important, because we know that when we neglect ourselves, we really are neglecting the people that we intend to really care for. So we want to make sure that we are taking care of our whole selves.
And as we wrap up our first segment, have you seen instances during the course of your practice where people come in and they are just overwhelmed with life and things that they've got going on?
Every day.
And not only being overwhelmed with life, but also the physical issues that can result from that.
Every day. Every day. I would say that I would say that a large number of physical ailments manifest themselves in the physical because of what we're experiencing in the emotional.
Wow.
And so I see a lot of depression. I see a lot of, you know, mental health issues. A lot of women are in denial because we do have that superwoman complex, and that's a whole nother show. But we have that feeling that we have to do it all, that we can do it all, and when we don't do it all, then we feel bad about ourselves.
Wow.
And that's again a whole nother show. So I think that focusing again on those things are going to be a huge piece of what brings us wellness.
Yeah.
You know, if you neglect one part of the body, the other one is going to fall short. How
do you even define wellness? What does wellness mean?
Well, I think it's multifaceted. I think there are several components to wellness. We think about it primarily in the physical sense. So most people know that they have to eat well and try to get in some physical activity. You see, I'm wearing my Fitbit.
Yeah, me too. Even though I don't use it.
Every day I
That's
look at it.
That's another show.
Yeah. You know, get enough sleep, having a proper diet, again, taking time for yourself, just stealing away moments of meditation, your spiritual health, going to church, fellowshipping with people who think and believe what you believe, participating in things in the community, organizations in the community, and feeling the sense of feeling like you're giving back.
And I'm going to put a pin in that right there, because we want you to come back. We've got more with Dr. Paula Orr of Charleston Women's Wellness Center right here on Low Country Spotlight. Don't you go anywhere.